Silence. Information is not readily available. I encourage people to carry this little red folder of health and try to distribute that and try to make that happen. But I realize it's a challenge and they need to understand what that means. So keeping track and monitoring. There's other websites right now looking at your own blood pressure. Who knows their blood pressure? Who knows their cholesterol, their blood sugar? These are numbers that you should really take ownership over. Next slide, please. Always have a list of medications in your world. Update it. There are over 30,000 people that get hospitalized every year because of medical errors. A lot of them are preventable, but I actually know exactly what you're taking. And I don't know about you, but I don't adjust my electrical panel in my house. I have respect for electricity. I also respect for medicines. And you can have different opinions from different doctors, different nurses, different chiropractors, that's fine. But know the information, work with your pharmacists, work with your physicians, work with your nurses, work with everybody you want to. Make sure you get the appropriate information, and most scientific information, but know exactly what's going on. Empower people to be responsible for their health. My observation is most people don't want it. You do it, that's your job. I understand. I would like to make that a shared responsibility. Next slide, please. There is no such thing such as a sudden heart attack. It requires years of preparation. If your stomach arrives before you, that's a heart attack waiting to happen. These tissues are very metabolically active, and I'm still struggling. I'm not perfect. I'm still working to become thinner. Tomorrow morning I'll be playing squash with my squash buddies, and I keep wishing to be 10 to 15 pounds lighter, and I'm going to keep working. We have a program called Lifestyle Intervention Forever. This is actually our annual barbecue. My wife carrying the back, and my kids and things are very kind enough to put up with you since 19. This is one of our websites, healthcorner.ca, and you're welcome to use it. drkirby.com is a much better website, and it's becoming more interactive. That will change. So I encourage you actually to sign up if you'd like to, because it's important that we get feedback, information. Science changes, we change very quickly. And so that's why you need to work with people that are up to date and working at this. And that's, I can only be up to date in my own world. At one time I thought vitamins and omega-3s were a good thing. Now eating fish 3 times a week is a really good choice. And eating brownies that have beans and stuff like that is actually the better choice. The problem is that having beans to a large degree, I think you should have one bean night. And basically not go out the next day because the next door neighbors won't enjoy it. So I think a family that has beans together will fart together and stay together. But the family that doesn't have beans shouldn't go out the next day. Basically, to get to the top of Google depends on who pays and how many hits. It's a complicated formula. But it's not based on science. There's something called Google HOH, gives you more science. So when you use the internet, you want to basically Google websites that have more science, Mayo Clinic, Harvard, places, Canadian government websites, things that not trying to sell you something. Buy fresh, buy local. We have these monthly meetings once a month or so. We have this in a church basement in Hamilton called Life Meeting, and you're very welcome to come to this. And I think having people working together in some way is important. Surround yourself with people who are more motivated. Unfortunately, not enough people. What I would love to do is that the people who come and see me, the people who come prepared for their visit, who come in with somebody else. And one thing, when you go to a doctor's office, is that you will retain about 10% of the information that's said. You go to your accountants, your lawyers, to your mechanic, 6 months from now, you'll remember 10% what they told you. Bringing somebody, increase that to 15%. Bring a smart person, bring it even higher. So bring your notes, bring information, bring somebody else at something that's an important decision. And come prepared. So I want to thank you all for coming out here tonight. And we'll answer some questions. Can I have the lights to go on, if that's okay?